Good evening, everyone. I welcome you all to this 20th Roundtable by NJH. And this is Dr. Vishali Saraswat. And I have this amazing board for Roundtable today, all our EB members. We are here to discuss about respiratory. Now, when we talk about respiratory, it seems like a very huge topic. So we have decided to keep ourselves restricted only to upper respiratory. So more about that in the later, soon I'll talk more about that. But first and foremost, let me introduce myself. I'm Dr. Vishali Saraswat. I'm practicing for last 23 years in Mumbai. And I have had the pleasure of being a student for all most of the board today. Vaishali madam has been my teacher in college. Ajit sir has been my eternal teacher. Bhaskar sir has been my teacher. I've been learning so much from each of them. And Shahala, we just decided that we are homeopathic sisters. We are learning from each other every single day. Yeah, so it's so amazing to hold these roundtables month after month. Every fourth Saturday, we are having roundtables wherein we help homeopaths understand how they can approach a certain disease, wherein we discuss so many things. And I have received such amazing feedbacks for our roundtable that students are enjoying it. Those who are not understanding how to start their studies get an insight into it once they attend one of the roundtable. Practitioners who have been into practice gets a refresher in just this 1 hour, and those who are just on the brink of whether to go for allopathy or homeopathy or what to do, they get a clear idea that you must start with homeopathy. So that is the power of roundtable. And without much delay, let me just welcome my board today, and let us start with the senior most teacher. Bhaskar sir, where are you today? Sir, aap mute pe hai. You're on mute, sir.
I am at Ahmedabad at home, taking rest and enjoying 3 days vacation because of monsoon respiratory infection.
The most needed one. Monsoon is late already in which ways.
Since today morning I don't have fever. Otherwise for 2 days I had a fever and I'm taking rest. But it's joyful to talk about it because you are not well. There's the right time when you can talk about it. I'm working in homeopathy since last 45 years in Ahmedabad only. And that's all. I mean,
really appreciate your participating even when you are not so well, sir.
The topic is related to me.
Topic is a live example. Wonderful. Thank you so much for joining, sir. And Ajit sir, where are you? Satara, Pune?
Yeah, I am at Pune.
Okay.
Yeah.
Wonderful. So happy to have you, sir. And in the trying time for family, even then you are here with us. Really, really appreciate that. Thank you so much.
Thank you.
Vaishali ma'am. You're on mute, ma'am.
Good evening, all. I'm also in Pune. As today I'm blessed with the rains in Pune. All of a sudden, it's raining heavily, dogs and cats. And I hope that this webinar, when we say it is all about respiratory system, and suddenly a terminology where the students I often faced using that all the symptoms of upper respiratory tract is aggravated by C capital, O capital, W capital, and it was astonished to others that we say cow.
Cow.
So cow and blessed with this note. And from today, that there is going to be cow, and we are going to see more and more patients of respiratory system.
Wonderful. I really like this cow. Wonderful. And Shahala, where are you in your all travel?
Good evening, everybody. I'm in Belgaum at the moment in my clinic, and I totally share my experiences right here about the weather. The same weather in Belgaum. It's drizzling from morning, and I think this is going to be an onset of late onset of monsoons actually for a place like Belgaum. But we are already getting cases, and like today, I would like to highlight upon how cold can be present throughout the year, but how also it is so common in summer, though it is called as a cold symptom. So hoping to have a good discussion around here, especially
Beautiful,
with all.
beautiful. Let's, thank you so much, each and every one of you, for joining today and talking about it. And why upper respiratory? So let us just think about it first. Why? Because it is going to give you bread and butter in your practice. It's going to be you can treat big diseases like cancer and rheumatoid arthritis and psoriasis and whatever, but you do not give result in somebody's sneezing and the entire family will go to someone else. So this is going to be 101% one sector which will give you your consistent flow of patients, and almost everybody is susceptible to it, right? Allergies you talk about, or you talk about viral infections, or you talk about bacterial infection, a person experiences that at least once a year. So this is definitely hands down bread and butter for a homeopath. And for any
Vrishali,
yes sir,
our Mater America is the bread and Repertory is the butter.
absolutely sir. Spoken like proper materia medica person. Yes, materia medica is the bread and repertory is the butter. Yes, and we want bread, butter and pastry too. That's why we want to learn from you, sir.
Yes.
And when there is a result, there is a cake.
Yes.
Rather, every homeopath or practitioner in this season is getting 20% more patient than the average.
Yes.
If he's getting 50, he'll be getting almost 60 or 70% per day. Because that 20% actually, or 30% extra, is because of the acute infections in this season.
Yes.
The beginning of monsoon or till the monsoon ends.
Absolutely.
Doctors have no vacation from June to almost October.
Yes. June to October is our peak season. I mean, season is something I do not like to call it because I don't want patients to fall sick. But,
not in your hand.
Rather, it's an opportunity for us to spread our science and to serve the humanity. It's the best opportunity. Yeah.
Right.
So I would urge Vaishali madam, if you can talk a little about allergies, because every other person uses this terminology so loosely. So if you can just briefly tell us what exactly is this allergy and how do we look at it?
At the outset of COVID, we remember that everyone were taking vitamin C. And it was like a compulsion to have vitamin C in their house, even though we as an Indian are very much used to have lemons as vitamin C. I was just going through students' lecture, and then I said them that it is which vitamin very important for us in respiratory problems. So everyone said it is vitamin C. I said it is very nice, vitamin C, but for me it is vitamin M. So all they were astonished. What is vitamin M? We have never heard, madam, there is any new. Yes, I said you have to go for research, and research is a very important aspect. Anybody from you can just type what is vitamin M on the chat board. So we have vitamin M. So all of them were saying some. Said, okay, let me go into the details about vitamin M as money. Will you accept it? Yes. So it is money, M, which is going to flourish us after when we are going to have good outset and insight of respiratory diseases. And when it comes with allergies, we have to know our anatomy and physiology well. So all on the occasion of this webinar, And as we are on Facebook and we are having new budding homeopaths, the anatomy of respiratory system, which starts from nose, external, internal, and the whole upper respiratory tract, which is actually covered with the respiratory mucosa and the olfactory nerve cells, where we have the smell, and that is the anosmia. We have the vibrissae, which is very fine in the this aspect of alanasi, which will hold the all foreign bodies with it, will not allow the foreign bodies to enter. And the enocilias, which are actually used to warm up the air, which is outer, and make the temperature, humidity equal to what is there in the lower respiratory tract. So when we are exposed to all the external morbid aspects, maybe it is as a dust, maybe it is as any allergic substances, you are using flowers, you are using perfumes, and that gives you allergic reaction. So what is this allergic reaction? If we are talking about the antipathic mode of treatment, there is a very good medicine which is called as histamine. So antihistamine medicines we are taking. Here we have homeopathy also, and that the lots of research has gone through it. And the simple remedy, which is called as histaminum, has been come out through a very research outlook of, and it has been published in Dr. Dana Ullman's research paper, and the others who have already worked on it, and they have seen the effects of basophils in it. So the in vitro and the cellular type of cytology, where we are going to study the research aspect of homeopathy in depth and understand the evidences of this allergic rhinitis, why it is coming, and give our homeopathy into holistic approach. I think that will solve the cases. We have n number of remedies with us. The only aspect is our perspective of hearing the complaints of the patient, putting it into good data analysis, evaluation, and synthesis, and coming to a correct simillimum to give the relief to the patient. And your allergies are out.
Wonderful, wonderful. You know, there are so many things which Vaishali madam has already spoken about, and we definitely need to ponder over it. And interestingly, you have already touched one of the important remedies without mentioning it, right? So, yes, sir, you want to talk about it first? Sir, I can't hear you. You're on mute,
sir.
Vaishali has opened the issue very well. There need to be a differentiation between allergy and infection also. Usually, this is very important for a homeopath to understand. The first thing is that if you take the fever, which is usually absent in allergic subjects, fairly common in infections. Then if you see the malaise, which is rare, almost not available in allergy, whereas it is very, very common in cases of infection. Then apart from the malaise, you also get body ache, which is fairly common in infection, not available in allergy. And the last thing is the cough. Usually, except the asthmatic patients, coughing is not so common in allergy, but in infections with sore throat and all these symptoms, you get a typical influenza type of symptoms. So these four differentiating points are very important, whether it is allergic or whether it is related to infection.
Very, very well put up, sir. And with these differentiations, when we meticulously take right at the onset of the case taking, that is when we can, you know, get ourselves into different remedy sets, and we can be more effective. Absolutely. So yes, sir. Bhaskar sir, you want to say something?
Yes, I would like to add a few things to the same subject which Dr. Vaishali and Dr. Kulkarni sir has started. Allergies are really different, and histamine is one of the best remedy or known remedy, recently used in last 20 years only. Before that, it was not known even. But apart from that, when monsoon is there, it is not only the allergy, but the weather changes, the ionic change in the atmosphere. It brings certain viruses and bacteria become active. Those were inactive earlier for years, for 6 months or 1 year, they become active. The way you are seeing that roadside grass just grow up within a week of a rain. So these viruses or bacteria, when they become active, and you are literally allergic also, both the things go together, and you are supposed to take care, not with the histamine only, but you are supposed to go for further, because this is the personal, every individuality has got a different reaction to the atmosphere as well as to the virus and bacteria. Only pure allergy is concerned, it is an excellent remedy. But when it is not pure allergy, then definitely you require something more than that. Secondly, allergy contains or creates only sneezing, itching, running nose, that is all. But when there is a greenish discharge, yellowish discharge, thick discharge, sore throat, there is definitely a secondary bacterial infection which is already lying there in the throat actually, or guts. They were not active, but because of the weather, you are disturbed actually, which disturbs your immunity, you develop not many other symptoms, and that is all correlated to the monsoon. That's what I have suffered, and I know that's what has happened.
And another aspect is diabetes.
Sugar.
So it starts with allergic rhinitis maybe, or allergic pharyngitis, and lands into bacterial. So
that happens. That
yeah.
happens. That's true.
So
yeah, one more important point is the time duration. An allergy can last for longer times, more than even 4 weeks to 6 weeks.
Right.
Or until the exposure to the allergen takes place. Whereas a common cold, which is a very famous saying right from beginning, whether you treat or you don't treat, it lasts for 7 days. But yet, as a homeopath, that's why it's our bread, butter, and jam. Because in spite of the cold remaining for a week, the patient does suffer. Like Dr. Ajit Kulkarni sir just mentioned that you have body ache, malaise, and you tend to have itching of the eyes. So these symptoms can be taken care, and beautifully we have remedies like Allium cepa, Arsayo, Gelsemium is the most important remedy. So the time duration is another what you call factor which we can differentiate between allergies and what you call your common cold.
Or usually, febrile symptoms are not associated with the allergy. Usually, it can be added after because of the secondary infections. But usually, when it is pure allergy, febrile symptoms are very less.
Yes.
You said there is an issue about histamine, because histamine causes a kind of a sleepiness, lethargy, dullness. And sometimes the data is mixed, because we go to gelsemium because the patient has sleepiness. So we must differentiate at this point that whether really the case is of sleepiness naturally or brought on by the histamine.
Right.
So how will we differentiate that, sir?
The point is that you see, after histamine, the sleepiness began, then it is attributed to the histamine. If right from the beginning of the illness, right from the first day, if the patient feels dull, wants to lie down, then it is a natural expression of a disorder. This is the best way to understand. Second thing is, in the follow-up, you should ask the patient to stop histamine and then see the result. If the patient has natural expression of the gelsemium, then you are right, continue with gelsemium.
Right.
Then I have one more observation about this dullness appearing as a process of the evolution. Yes, you were right that you began with gelsemium, but it didn't stop the further progress into coughing, some kind of a whistling, wheezing, rattling. Then the sleepiness is present, the patient has become dull, but the lower tract is involved. Then I have found antimtart as a follow-up of gelsemium.
Yes.
Yeah.
I agree. Antimtart is really working when there is a secondary infection goes to the lower chest.
Yeah.
when dealing with upper respiratory tract allergic rhinitis, with the watery
Nasal discharge.
nasal discharge. So we can have that it is bland, whether it is corrosive, it destroys the inner mucosal membrane, or it is so acute that there is lacrimation from eyes and lacrimation from nose, like what we say. So it is, we have common remedies. So all these remedies like Allium cepa, Natramur, sanguinaria if it is headache, Gelsemium when it is dull headache. So
When
it
you
will come up.
fresh
Aphasia comes up. So with all these remedies, when we are giving, like even like Solidago, which has pollen grains and dust mites allergies. So we are giving all these remedies for allergies pertaining to the symptomatology. But yes, after giving so many remedies, yet the patient, along with the constitutional remedy, we have given, and there is no satisfactory result yet. So I have observed in my clinical practice that when I'm giving histamine 30, 200 as per the need, patient is coming with relief. Definitely.
Okay. Yeah. So in my practice, if upper respiratory best selected remedy fails, constitutional fails, one dose of basilinum does the magic. I mean,
Yes,
magic is the
basilinum
wrong
is
word, but that's the science that there is a miasmatic block. Somewhere, you know,
yes.
you have to think about basilinum is like the if antibiotic is something for allopathy, basilinum is for homeopathy is what I would say.
In that case, I will put two things. Miasm is concerned.
Basilinum usually we tend
Monsoon.
to give more in bacterial infections. Sorinum would be more in viral infections. Tuberculum in recurrent what we call cold infections, especially occurring in any seasons,
Yes.
whether it is summer, winter, or rainy. So these are few of the inputs like.
But I had seen it actually when there is a viral infection recurrently, or any infection that is basically a viral, where there is in the beginning no actually discharges, etc. And if you have got a history of psychotic miasm, a dose of thuja does wonder, particularly in the cases where arsenic is used, or even anti-Mars or SARS, and they all remedy. Rather responding to the tuberculum, they respond more to the thuja. A dose of thuja in between for a day or two, it clears the picture very fast.
So, sir, how long should one wait to give a dose of thuja or basilinum, or
24 hours.
24 hours?
By the time you will realize your patient is responding, but the things are repeating and symptoms are the same.
Okay.
Intensity might be little changed, but the trouble is there. So a dose of antimiasmatic, and then again the remedy will clear the case.
Beautiful. Beautiful. Okay.
I have something to offer when
Yes,
we
sir.
are using a nosol, or rather the concept at a deep level of giving a constitutional as an acute. Then the condition has to be defined more in terms of the magnitude. Now, any nosol is first a remedy, then it becomes a nosol.
Right.
And we say that the very basis of giving solinum could be just a remedy. It is a nosol is altogether a different idea. If that idea is prevalent today, so the very basis of giving solinum is a miasmatic prescription, then it is altogether a different qualitative aspect. But solinum is one of the grand remedies like arsenic against a case of respiratory infection where you get foul discharge and severe debility. What is lacking in solinum is the irritability and the restlessness of arsenic album. So many times you will find that, yes, you begin with arsenic album. Unfortunately, the patient becomes very weak. He may be better at the level of the coryza. But you find that the general weakness is very tremendous. And it is better you can move to solinum
Yes.
with foul discharge, and you will find that the patient rallies very well. Rather, there is this one more observation of solinum. In any patient with any acute illness, as a part of the convalescence period being delayed, recuperation being delayed, one of the best tonics in homeopathy. Apart from alfalfa and avena, sativa, China, all these things, Solinum is the greatest tonic according to me in homeopathy. Of course, there are a lot of tonics, but I give more value to Solinum. Incidentally, I will take one more aspect of understanding Solinum. I have found it as a very useful remedy in cancer chemotherapy that causes severe weakness. So it is my sheet anchor after uranium nitricum. When the patient is between life and death, and the patient has been put on chemotherapy, and there is a very severe acute debility with WBC count being too low, and there is a very profound prostration. Think of two remedies apart from arsenic: uranium nitricum and Solinum. Yeah,
That's a very good
Same way I will put it. Arsenic with Solinum, or even tuberculinum, arsenic with tuberculinum,
yeah,
or even thuja, arsenic with thuja. They are all wonderful things. Somebody asked how many days or how many times you repeat. Usually I used to say, if the remedy is working and second day is feeling better, again one more day I will give a dose of thuja again for 2 days or 3 days, single dose. And I see the response is so good that within 3 days he is getting rid of his cold. But apart, these no source or anti-miasmatic remedies, you should be careful about few more things. You should have a detailed history of the patient earlier, so you know the background. You should have their habits. Suppose Solinum patient is not chilly and feeling very hot, then I doubt Solinum will work. If there is a patient is not chilly at all, their habits. That's a strong.
Go ahead, sir.
Certain features of this no source and anti-miasmatic remedies are very strongly situated in the patient, which indicate he gives this remedy. When patient is chilly, I will not go for thuja, but will go for the Solinum.
Yeah.
And patient is very almost, you can say, controlled, keeping things inside, hardly talks, but he is arsenic, so I will go for thuja. So you are supposed to select a remedy according to the basic constitution or according to the basic miasmatic background. And that is always important.
Wonderful. Wonderful.
What I do in such cases, when a case is confronted, I have, you see, the first section about the sore throat.
Yes.
Then the upper one, frontal sinusitis. Then I go to the maxillary sinusitis, then frontal sinusitis. Then I see the general reaction of the system. If the pharynx and larynx are involved, with a tickling in larynx, with chills and fever, then I usually go to hypersulfuricum, especially when there is an exposure to cold. What is the difference between hypersulfuricum and arsenic is at that stage? Both have exposure to cold aggravation, both have elements from cold drinks or ice cream in general. Or even you will find the right rustox, they both have also exposure to rainy cold weather. Or actually they are drenched in cold with the exposure. And so you will find that the difference is that the debility which you see in arsenic, you don't see in hypersulfuricum, and a little bit laryngeal catarrh with hoarseness, which you see mark in hyper. Usually, arsenic is without hoarseness. This is my experience since many years. Yeah.
Right.
Wonderful. So at this point, like we are midway in the discussion, shall we, because, theoretically we are understanding this, but if we share maybe one case, it will be easy. So Shahala, do you want to go ahead and share one case to start with?
Yeah, maybe today's case only I will just share with you. It is upper respiratory tract infection. Group was a symptom. That is tracheobronchitis, sort of symptoms were there. And like I told you, the weather has suddenly changed in the last 2 to 3 days. The days are very hot and the evenings are quite cold at the moment, or it's raining towards the evening here. So bryonia is one of such remedies which can be used in cough, which just starts at the beginning of this type of upper respiratory tract infections. It's an acute remedy, and that is how Boric has mentioned. These two remedies, bryonia and what you call gelsemium, act equally well in winter season as well as the end of summer. Okay, if the line is written, for example, in gelsemium, he has written that gelsemium acts better when the barometer starts falling down. So it is a dual remedy, a remedy which can be used for acute manifestations, both in summer and winter. And today's case was bryonia. This patient just came with white coating of tongue, and he had come from Madhya Pradesh to Belgaum, that traveling time yesterday. It was a child of 9 years old. He also had diarrhea. Okay, and this particular child had diarrhea, and the sister of this particular child, he's a male patient, and the elder sister, 3 years elder to him, had what you call only dry cough. So for both the kids, though the family is same, though they traveled, modalities are almost same, but this second child, the younger boy, he had what you call diarrhea. Antimcrude was the remedy given, and fantastically, within just 3 doses, water dose of course, he recovered very well till 4:30 in the evening, because I was having a practice till 5 today. And the other child, the mother says the cough has come down. The elder girl, she has come down almost by 70 to 80%. So again, that is the magic of homeopathic remedies, because we could have just told them it's an indisposition, you have traveled yesterday, you can take some rest. But since the child had only 4 to 5 diarrhea, but the diarrhea completely has stopped. So again, if you go back to Materia Medica and refer, these are the remedies. So these two cases are very fresh in my mind because I've just finished with them today.
Wonderful, wonderful. Vaishali ma'am, your case.
Yeah, I would like to discuss a chronic case. Like it's a long, maybe 10, 20 years. It was just a beginning of my practice. And at that time, the respiratory cases were frequent as it. And then this patient, who was a teacher, professor in the pharmacy department, had come to me in the Ranvana campus OPD. And he came with allergic rhinitis and could not breathe, stoppage of right nostril, alternate nostril. And that time we used to ask questions, and all our interns used to ask to do the clinical examination, and nothing was done. Only all the acute symptomatology was noted, and we were giving the remedies like arsenic album, which was coming. And then next week, not better, again another remedy. So we were switching off the remedy quite frequently. But then it was a time that I have to have an opinion of an ENT surgeon for this, and I sent this patient to ENT surgeon, where a huge polyp was found out, and a DNS, deviated nasal septum, which is the cause of recurrent rhinitis, and this which leaded once into chronic sinusitis also. And the patient had come with sinusitis one time. So the causa, as we say, that it is very important that there is a polyp, and there is deviated nasal septum, and the symptomatology came to as sticky nasal discharge and blocking the whole mouth breathing and everything. Kali Bichrome 200 gave a wonderful magic result. And this gave me that, yes, there is a need to send the patient at the right time to an ENT surgeon, because the equipments are not there with me to go into the detailings of the ENT. Yeah. And the right time, the right diagnosis, and the right approach. Always.
This is very, very important. You know, before I go to Ajit sir and Bhaskar sir, I just want to highlight here that how important physical examination is. That, you know, you have to get up from your chair and you're questioning, put the stethoscope, press your maxillary sinuses, your frontal sinuses, and examine. Touch the patient, examine. It is extremely essential, at least in respiratory. Yes, sir? Ajit sir, you want to share a couple of cases?
A lot of cases, but I want to share 2 small cases. One case is a very interesting case of a boy. Actually, this case was referred by an Israeli homeopath at me. The story began with obstruction of the nose on exposure to cold. So he first gave Naxwamika. The child was playing very well, very active. There was thirstlessness. There was a white coated tongue. So he gave Naxwamika. But the child didn't improve. And it went into more obstruction. And the obstruction was such that the child was entirely restless throughout the day and night, snuffling. And the situation was that the child is not better at all. He became extremely irritable. Then at this stage, he consulted me and I took the totality and I found that, yes, it is a very good case of ammonium carbonicum. Everything matches very well. Typical 3 a.m. aggravation was observed, like kali carbonicum. So post midnight, more aggravation of the obstruction of the nose. After ammonium carbonicum, he had one epistaxis and there was an amelioration. So I told that this is a very good reaction. It's a reaction after ammonium carb that the congestion disappeared. The child started playing and after 2-3 days, the child started coughing. See now, very interesting. After ammonium carb, he was better and the child started coughing. And the child gradually started coughing in such a way that it became a very severe spasmodic cough. Then the constant, the severity, the suffocation and everything was so bad that the parents were unable to look at him. So the referring homeopath gave him by the totality cuprametallicum, it didn't work. And he gave Drosera, it didn't work. Then again he consulted me. Ajit, do you remember last 10-15 days back you had ammonium carb and this patient was better and now he has this particular state. And we are exhausted with the remedies. Drosera, Coralum, Rubrum, Cuprum metallicum has been given and now we are stuck. We don't understand what to do. I had acute prescribing article written by K.M. Kasser in Symposium Volumes when I was a student of homeopathy. For your just information, I read ICR's all volumes in my second year of my college life.
Oh, that's too early.
Amazing time. I wish all students were able to do that.
Yes.
Amazing, sir.
When I told this information, when I first met Dr. M.L. Davde, he stood and did like this to me. Just a memory.
Good,
And you
good,
see
good.
that it was mentioned that when a case doesn't respond, very severe, this is a tubercular miasm which you have to take into account, and you can give tuberculinum daily until you get a reaction. I just follow Ken Kasser's observation and gave tuberculinum 1 and 3 times for 3 days, and the case responded.
Lovely.
Good,
Lovely case, sir.
very good.
Yeah. The second case is a very interesting case, very simple, sneezing, obstruction of the nose, mild husky voice, and allergy. So I began with allium cepa, better in open air, worse in closed room. So allium cepa didn't work at all. And the patient went into severe obstruction of the nose. So I was just trying to understand whether allium cepa covers obstruction of the nose. No Matermedica gives it. So the case is really has moved to another remedy. So I wanted a remedy which is like allium cepa, but has obstruction more. Meanwhile, the sensitivity to cold air increase a lot. Now see how the changes occur within 2 to 3 days. I searched for a remedy, and the remedy was, you will find aurum trifilium. And with aurum trifilinum, the case responded within 1 day. 1 a.m. every 4 hours for 2 days. After 2 days, patient had nothing to treat.
Wow.
Yeah. So sometimes you have to see how the changes occur in the acute, and the remedy goes from one state to the other state.
Yes, this is very important. Most of the times homeopaths will define the case and sit with that remedy as if it's our surname. They don't want to move from there. So this is very important. When the case moves, you have to also move and search for another remedy. Amazing learning, sir. So arum triphyllum is another one, which is like allium cepa when it fails and moves to another level. Arum triphyllum is something which we
If
can
you see the
definitely look for.
differentiation more, there is a constant picking of the nose in arum triphyllum, whereas this symptom is not present
Yes,
in allium cepa.
allium cepa.
Yeah.
Beautiful, beautiful. Bhaskar sir.
Yes, I would like to go for two cases.
Yes.
And one case is so interesting. The woman was almost 84, 85 when she came to my clinic. She was talkative. She talked about her history. She was obese and dominant. Her family, her son was she got two sons, but she's staying with the younger one. He told me, doctor, my mother, when talk to you, don't interrupt. Otherwise, there will be a fight. She cannot tolerate it. I said, okay. I listen. And she has got a lot of feeling of throat, heat. And ultimately, I gave Calcutta Cab. Couple of weeks, and she came back. She was listening less at that time. At present, she is still living 94. Now she is totally deaf. But that's a part of the aging process. But next time when she shouted and she said, doctor, why don't you give something? I would like to get rid of myself. This is not the way you are treating me. And nothing is happening to my cold, etc., etc. And then I realized there is something different than calcarea. This is not calcarea. Calcarea won't shout like this or won't dominate like this. And I took these rubrics, dominance, strong, the way she shouts, and every year before monsoon starts, and she had the cold and cough. And that lasts for almost 6 months. And I came out with a remedy, Dalkamara. I gave her Dalkamara 30 BD. Within 3 days, the things were subsided. I continued it for 15 days. It was because she's used to get it regularly. She said, give me a 1 month medicine. I want to take it for a month. Next year, she came, give me the same remedy. Don't ask me. Don't ask me, give me the same remedy. And since last 10 years, she is on Dalkamara every year. Couple of times she used to come, or she'll not come now. She'll send somebody. And still she's at 94. Without listening, she will talk to others. You have to answer in the writing only. But she is so strong and dominant. And she will live with the Dalkamara. Her cold, cough, etc. had gone to almost nil for what she had come. Aging is a different process. So she is unable to walk properly. But that is a part of her osteoarthritis at this age. And she doesn't want to go for operation. There was another patient. A radiologist came to me. My mother is not well. I had been to where I had got this X-rays, etc. And she has got some problems. And then it came out of chronic bronchitis recurrently since long, and not well after a lot of problem in the season, this monsoon season. I asked him, took the history and asked, how did it develop? She said, I used to get recurrent cold cough, and then, we got a joint family. I brought up my kids, and then we separated. And then that was also not good, but I did it. Then one son had gone out, and then again, I had feeling bad. And then she gave this history for the first time about her family. She said, don't talk to these things to other people. My son is a doctor, and and it will feel bad. He will feel bad. I said, he will not feel bad. If you are happy, he will be happy. In this case, every monsoon, chronic bronchitis aggravates. That was the strong thing. But her grief, her anger, her fear, her anxiety, it was strongly dominating. I started with Natrum Sulf. And Natrum Sulf 200 every week for the entire monsoon session for almost 5 years. By that time, she recovered a lot. Person went to Canada with her, and from Canada, he asked, "Give me some medicine for a year." She's doing well over here. This is a long, old case. But see the way homeopathic works. This chronic bronchitis cannot be cured by anybody in the allopathy or anywhere else.
Yes.
I doubt whether she's totally cured. But she was comfortably living for so many years. That is the best part. Homeopathy worked in such a way that her every monsoon was a problem for that woman. That problem has gone. In acute cases, we are all of us, we are seeing daily patients almost in this season. 5% for the coryza is common. And your patient, if you give a right remedy, acute one, which is related to the patient, within 3 days, 2 days, 5 days, they used to come out. I myself, when I got this problem, I got a sore throat, hoarseness, and then I waited till evening and I started having a greenish discharge. And I realized this is Merxol. I started Merxol. Within 24 hours, I was feeling better, but not fever was there. So I continued it again. Merxol 1 ml in water in divided doses every hour. And then Mithal suggested you should take Thuja intercurrently, which you used to give to others. Why don't you take? Why should I take? Say you got fixity. you don't even. I took a dose of Thuja, and today I got no fever, nothing.
Wonderful. Wonderful. This is a good reminder, sir, because most of the times we homeopaths forget homeopathy when it comes to us.
We do it for others, but when it comes to us, wait. Let us see what happens.
So, I'll share very quickly 2 cases. One was of a middle-aged man who had developed morning allergies. So sneezing and a lot of discharge he used to get. For 6-8 months, he was having it every day. So he was around 40-45. And the story was, it was a very long case, but I'll share in a small snippet. The crux of the story was, he had just found out that his father was having another home.
Oh.
He had set up another home for himself, and father had also maintained this house and another house. And father made him buy, because he was the elder son, father made him buy new house for that lady.
Oh.
And he had no clue what he should be doing, and he was such a devoted son that he did that. And now he was in a fix, so he was having a conflict inside whether he should be telling his mother or he should be telling his brother, younger brother, because they have reverence for father. The whole family had reverence for father, and now they were clueless as to what is to be done. And he had that conflict of conscience inside. He did not know whether he should be providing for that house, and then whether he's cheating his mother, or whether if he doesn't do that, whether he's cheating his father. So there was such a big conflict. His anger had increased, and he had started having severe sneezing bouts of some 60-70 sneezes in the morning. So allergy, if we understand the psychodynamics of it,
yes,
he was not able to take it in. He's trying to throw it out very violently, but not able to express verbally. So I had given him, and he was a fantastic person all throughout, very, very jovial and all that. His kids used to be my patients. So I had known him for a very long time, and then suddenly this developed. So I had given him Ferrum Phos, because the kind of conflict which he had, conscience, what to do, what not to do, and the responsibility which he felt was like a huge mountain for him to climb.
Right.
It was so difficult for him to decide, and then I eased him out into saying that this is not your secret. It is your father's duty. You do whatever you want to do, but you don't find yourself in the mess of this. So that was first case. Second case was nasal polyp, as madam had reminded while you were talking, I recollected that case. So this guy had severe foul discharge and so much bad odor from the nose that for me to define his case was difficult, because he was sitting in that small cabin I used to practice earlier into, and there the smell was so much that it was very bad. So his entire family had kind of rejected him. He was also 35-40, and to add on, he also had uncontrolled diabetes. So then, he said, the way he spoke about the discharge which comes, it's like I just keep throwing it out. I throw it out like that. And whereas I said, how do you even throw this kind of a thing? And he had a good personality, but because of this foul odor and everything, his whole focus had become quite negative towards self. So there was a lot of depression, negative self-talk, and the whole disgust which the family was feeling, he was projecting on himself. So there's a long history, but to give you the gist, I had given him ambra gracia, wherein the whole logic of ambra gracia, how it is prepared. It is the disgusting.
Throw away the.
Yes, it's a disgusting discharge from a whale, which the whale throws out and it lands on the shore, and then out of that the most expensive perfume is made. It's actually disgusting. So this person was a very good man, but because of this discharge foul odor, he had become like a very he had developed disgust for himself. So that low feeling and all of that, I had given him ambra gracia. It worked very beautifully. His polyp had almost blocked his entire left nostril, and with ambra gracia, 1 year of treatment, it came down to very small, and then he stopped treatment. So I don't know whether it completely recovered or not, but had he completed, I was very confident that it would have gone. So psychodynamics is something which we can never neglect. Yes, sir.
One more point I would.
Yeah.
I would just like to say, and it's away from Matri Medica and this thing. One of the major cause in today's life, stress is the major cause of vasomotor reflex, which causes allergic rhinitis as well as common cold.
Yes.
So again, here we have a little better edge than allopathy system of medicine, because we go into these mental symptoms, and so beautifully Dr. Vishali and Ajit sir and even Bhaskar sir have depicted that mental symptoms were present in these individuals, and the exacerbations were occurring after this after ailments, you can call.
Because if you do not go to the maintaining cause and the main causative factor, then the treatment is just going to be symptomatic basic. If you do not identify, now this guy whom I gave ferrum phos, had I not solved his conflict, it wouldn't have, and if the entry in the case wouldn't have been from the conflict, I would have still given him something like euphrasia, and I don't know what all list I could have given him.
Yeah, apart from that, that's what homeopathy being such an old science, today's modern textbook talk about vasomotor reflex. But this has already been told in the mathematical so many years back.
Yes, absolutely.
We are far ahead in
Yes, Ajit sir.
subject.
Yeah.
Psychiatry,
You see that,
psychology, all allergic conditions. We are far ahead. Anyone had seen it before 200 years, which now they are taking care as a part of it. Science.
You see that when we are using the words like hypersensitivity in terms of allergy or even an infection, actually, that the germ therapy also says the same thing, germ therapy, that it is the hypersensitivity of an individual that brings on the allergy, that brings on the infection. It means we have to focus upon the host as a person rather than only the allergens. The matter is that when we are discussing the chronic variety of the disease, then we enter into the human being as a biological entity. And here you will find that the nose has a very typical symbolic language. And this is mostly related to the pride of a human being. Shurpanakha's nose was chopped off because it was the greatest insult. And then, Ravan was extremely angry because how he can tolerate the insult of the sister. So the nose is basically a very good entry point to understand. There are many people who have the habit to touch the nose while communicating. We have one politician from Mumbai who always touches that. And he's one of the known egoistic persons. So ego, the image, all are involved in the nose. Naturally, when you are not given freedom, there is nothing wrong with the nose, but you have the
when Kulkarni sir is there,
obstruction of the
take
nose.
care of your
Then
expression.
you are suffering from obstruction. There is nothing wrong with the nose, no. Then really the homeopathic science begins, where you take into account the symbolic language. You have something has to be dig out at the level of the personality and the life. So the case of Pass of Urushali indicates that conflict being
Yes.
available at the level of the nose.
It was an Iron Man.
Other issue is nose is an entry point and the discharging point of prana. We hold the inspiration and the expiration, the very basis of life. We have a very grand instrument, a filter. Such a micro filter has been given to the human beings or animals, that this fine balance, we do not allow the allergens to go into. The best defense is the sneezing. I always tell my patients, don't focus on the sneezing. The intelligent body will not leave the sneezing for a long time because it is helping the patient out. Because patient want relief, And I frankly tell them, I will prefer your sneezing should be cured at the end of the treatment, not first. If the first you will find sneezing is being suppressed, then it is a wrong direction. Yeah.
Very beautiful. Lovely. So, we've almost reached at the end of the hour, and there is so much to talk about even now. But let me just sum up what all we spoke today. We discussed about allergy. We discussed about the various research. We also spoke about Dr. Dana Ullman's research. And we've discussed about role of antimiasmatic, how to treat nosordis as the remedy first and antimiasmatic later, and in what way we can use, how much duration we should wait. So typically Bhaskar sir had mentioned that 24 hours is what we should wait for the remedy to act, and then we can think about giving any other maybe nosord or antimiasmatic. We have also spoken about various cases and so many remedies: ammonium carb, allium cepa, arum triphyllum, how sorinum, when arsenic album and sorinum, the comparison was beautiful, sir. And there are so many points which we have discussed. This cases, Shahala's cases, both the kids, so amazing. And my case of ambragracia and ferrum phos. And there are some questions in the chat box. What I can tell you is, because we have come at the end of our session, no matter what we do, what I have assembled, I have understood from all of you today is, no matter what is the case, you take full totality, you go to the materia medica, and you go to the constitutional. Acutes will help you only this much. If you want to walk the full length, then you must go to the constitutional, right? And having said that, I want to thank all of you for this wonderful brainstorming. And I hope we are able to do many more of these kind of discussions. So there are a lot of things like, summer coryza is something which is a reality. We must address that. There is one symptom which just came to me recently. I've treated a patient with it, coryza only while eating. Yeah, which remedy? Anybody remembers? because I am having kind of a brain fag. I think it is Dalkamara, but there is only one remedy and I've given it to a patient and it is acted so well. Okay. So there are things like that. So minute things I would highly recommend that go to. Ajit sir has also said repertory is your, Bible. It's your Bhagavad Gita today. So you must go to repertory in every case. So Coryza chapter is such a beautiful chapter. You must in under nose, you go through the subsection of Coryza and find out, go to the specifics of every case, and that will help you solve it, right? Any parting remarks you guys want to say?
Yes, Dr. Vishal is talking something.
Yeah, respiratory system, respiratory disease are actually the wholesome, the upper respiratory tract, lower respiratory tract, nothing can be talked on part, as we all know.
Yes.
Holistically, we
Yes.
have to deal with body, mind, and soul. So whatever the budding homeopaths are hearing our talk, and the practitioners and the students and the postgraduate students and the PhD aspirants, all the students, there has to be a takeaway home message that it is the all together, the holistically, whatever we are doing in finding out the correct simillimum has to have a solid base on what we have to give. And giving remedies is not only the thing. You have to counsel the patient, you have to have a close vigilant of how the cure takes place step by step, and at what step you have to intervene with antimasmetic, antisyphilitic, and nosode, other things. At the right time, right medicine will definitely work. And with holistically, there has to be cure, there has to be rapid, gentle, permanent, as we all know. So it has to take
Absolutely.
time. You have to have patience and perseverance with the patient.
So I just want to remind our viewers that Vishpala madam is taking care of herself right now, and that's why we are missing her today in the webinar. But she sends all her love to all of you, and
Thank you.
mostly in the next webinar she will be here with us. Yes, Bhaskar sir.
Yeah, I'd like to add just one thing. Any allergy, any expressions of the body, physical level, running nose, running watery eyes, or any allergens that causes problem with the itching, etc. Particularly, they aggravate in monsoon. You must remember, it is a cry of the vital force that there are problems inside and you must study them. Don't take it just a symptom. Body is crying to have a help. And you are supposed to understand that part, that why he is getting or she is getting every year this particular month or this particular season or with this particular food, and then gradually things will come out. So that is always important to understand that just to suppress a symptom is not homeopathic medication.
Yeah.
You are supposed to take care of the patient as a person, and that will help a lot.
Beautiful, beautiful. So it's cry of the vital force is a wonderful thing, and I would like to close this roundtable with, just setting a reminder for all of you what Ajit sir mentioned, that it is prana, which is entering through respiratory, through your nose, and prana, which is exiting. So everything starts here and ends here. So stay true to that, and stay more tuned to that prana, and everything would be amazing. So thank you so much, guys. With this, we will wrap today's roundtable. It's amazing. Thank you so much for joining us. Keep showing this love every single time. Second Saturday webinars and fourth Saturday roundtables. Thank you. Thank you so much. Good night.
Thank you.
Good night.
Stay happy, stay healthy, and stay with NJH. Thank you.
Good night, everybody. Is there post-webinar meet?